Everyone has the right to effective healthcare and a well-functioning health system. Africa has made great strides in accelerating the major challenge of increasing access to medicines through various public health interventions. However, about half of the population in the poorest places still do not have access to safe, efficacious, and quality medical products. Local pharmaceutical production remains low, with only about 2% of consumed medicines being locally manufactured in Africa. About 25 to 30% of medical products are substandard and falsified, and illicit trade in pharmaceutical drugs remains persistent. This poses a series of threats to public health. Now, more than ever, it's time for change that will ensure African people have quality of life, sound health, and well-being, a priority area in the African Union Agenda 2063. The African Medicines Agency, or AMA Treaty, was endorsed in February 2019 by African heads of state as part of the journey towards an internationally recognized and well-established regulatory authority on the continent. As an organ of the African Union, legally mandated by member states, AMA's goal is to increase the availability of safe and affordable medicines and other health products on the continent. This will be achieved through providing regulatory oversight of selected medical products, as well as promoting regional and national cooperation and harmonization of regulatory decisions. AMA will also support the growth of local pharmaceutical companies, opening up and expanding markets across Africa, which is one of the key objectives of the Pharmaceutical Manufacturing Plan for Africa and the Africa Continental Free Trade Area. Working across 55 AU member states, regional economic communities, and regional health organizations, the African Medicines Agency will coordinate and strengthen ongoing regulatory harmonization in the following ways. Firstly, AMA will evaluate medical products for the treatment of priority diseases as determined by the African Union. It will also regularly inspect, coordinate, and share information about products that are authorized for marketing. AMA will coordinate joint reviews of clinical trials applications for vaccines, assessment of highly complex product dossiers such as biosimilars. AMA will also coordinate joint inspections of active pharmaceutical ingredients, API manufacturing sites. By developing common standards and regulations, AMA will also be responsible for harmonizing legislation. For the health and well-being of our people, let us take this further by establishing the African Medicines Agency. AMA must be ratified by at least 15 member states in order for it to come into force. We call on all African governments to ratify the AMA Treaty and endorse the transformation of our continent's pharmaceutical industry and health systems. With this support, the establishment of AMA will reach fruition. Contact the African Union for more information.